latest updates, subscribe to News 9.
Hello, you are watching News 9 Digital with me Amrita, and today I will be discussing about the changes which have been made to the coronavirus testing advisory by the Union Health Ministry. So the latest changes, there is one particular point which needs to be stressed upon. So these changes have come forth in the backdrop of the recommendations made by the National Task Force on COVID-19. What it does is it simplifies the coronavirus testing process, and for the state authorities it gives more freedom and flexibility to facilitate enhanced ease of testing for people. And for the people themselves, what they need to know more importantly is that now it provides for an on-demand COVID-19 testing to ensure higher levels of testing. This totally new section has been added to this particular advisory, which for all practical purposes does away with the prescription by registered medical practitioners, although state governments do reserve the right and freedom to decide on these simplified modalities. So what does this new section mention? First, it mentions that testing all of those people who are undertaking travel to foreign countries or even Indian states which requires a COVID-19 negative test at the point of entry can now get tested as well. The second and the most important point is that all individuals who wish to get themselves tested. So no more an individual need to have a reason to get a coronavirus test. They don't need to have come in contact with a coronavirus patient, nor do they have to be traveling or plan to travel to get themselves tested, nor do they need any prescription or recommendation by a medical practitioner. So anybody who is interested in getting tested can go to a nearby testing center and get themselves tested. Other than these new changes, it also mentions that 100% of people living in a containment zone should be tested using a rapid antigen test kit, especially in cities where there has been widespread transmission of the disease. It also mentions that if an individual tests negative for a rapid antigen test but has all the symptoms of COVID-19, then that person should be ensured a confirmatory negative test using an RT-PCR test, which is considered the gold standard for coronavirus testing. Moreover, it also mentions that emergency procedures or operations, including delivery of babies, should not be delayed due to lack of tests. Now, other than this, how hesitant or how forthcoming are people in India to get themselves tested for coronavirus? That's the most important question. So observations made on the field by officials say that people in general are apprehensive of getting themselves tested because they are afraid that they might test positive for COVID-19, and even though they are asymptomatic or even though they are young, they are afraid to face the consequences which brings the future consequences and the procedures which comes with the infection. But one needs to keep in mind that testing is important, because even if you're asymptomatic, you might be spreading the disease to other people. Now, other than this, there is another observation and prediction which is being made by the private testing laboratories in India, who expect people to demand more for antigen tests. So they expect an increase in demand for antigen testing because they think that people in India are curious to know whether they have had coronavirus in the past unknowingly and whether they have developed antibodies for the same or not. But one needs to keep in mind that antibodies do not necessarily mean immunity against COVID-19. You can leave your opinion in the comment section down below of what you think of the changes which are made to the testing advisory. Also, like, share and subscribe to News 9 Digital.